right, thank you. Thank you once again to our esteemed partners and members for joining the meeting. My name again is Mohamed Jamal, and I'm part of the Afya Innovation team. So today we are just going to highlight and sensitize ourselves on what we are working on and what we are going to launch soon. So this session is going to be more or less a session to just inform the members and the students and the faculty on the opportunities and the things that we are planning to do, and how everyone here can actually come in to participate, collaborate, and also to chip in to help. So just a brief on the healthcare landscape in Kenya. We've made significant strides over the years in the field of healthcare, but we know very well that we still have various challenges that are hindering us from delivering effective and accessible healthcare services to all our citizens. And some of these things include limited resources and infrastructure. We have a high burden of communicable diseases. We have a challenge with healthcare financing, with our NHIF, and the issues about limited insurance coverage, and patients not getting the financial risk protection they deserve. Other things include human resources for health. We have a shortage of, we are very, very far from the recommendation that we are supposed to be having in terms of the doctor-patient ratios and also the other healthcare cadres. Other challenges we are facing include fragmented healthcare information system and data management. We do not have a centralized system where there's an end-to-end interoperability and a flow of communication and healthcare information, right off from the primary care centers, the level 1 up to level 6. So these are some of the challenges that we have in our country, and many more. And therefore, we say that necessity is the mother of invention. So having limited resources and so much challenges, we believe that innovation is actually the best way out of this. And with innovation, there comes an improved efficiency, there comes an improved healthcare access. It brings about positive patient experiences and outcomes. It can help us to lower the cost of healthcare, both for the patient and also for the government, and also empowering our healthcare providers. Therefore, what is Afya Innovation Lab? This is a club within University of Nairobi College of Health Sciences, and our aim is to catalyze problem solving in healthcare system by empowering people to build innovative ideas to the healthcare challenges. So everyone today who is in the College of Health Sciences, myself included, and all the other members, are going to be the future healthcare workers and healthcare leaders. So we are trying to shape ourselves to tomorrow, to the future, so that we are able to chip in using this innovation platform to improve our patients' outcomes and experiences through technology, creativity, and collaboration. And one thing is that in medical school, we are not short of creativity, innovation, and brilliance. People come from very diverse backgrounds. People come from the most competitive, institutions in their both their county levels and national levels. And so we have a collection of some of the most brilliant people here. However, when we come to medical school, we get absorbed into the system whereby now we are all focusing on how we are going to proceed to the next level, and try to fit always taking time to think outside the box and think around other areas that might be very beneficial apart from the clinical care and our main focus of our courses. So that's why we have this today and what we are trying to do. And the slogan is teamwork makes the dream work. That collaboration is a core value in innovation and in everything that we will aspire to do and will endeavor to do. It is going to be something that cannot be done by one person. As you can see on this side, we have something, an icon, showing that someone has a puzzle, another one has another, and another one has another. So when one person has that side of the puzzle, it's not possible, it's not useful to it to be meaningful and to make any sense. However, when they both come together and they collaborate in making something, they're able to form, they complete the puzzle and actually form something meaningful. So, and that is the same thing we're trying to do here. So the goal is to bring on board all the stakeholders and any relevant institution and individuals who might be very important in this journey and in this endeavor. So that includes ourselves, the College of Health Science students, and that is not only to the medical students, the MBCHP, but also the dentist students, the pharmacy students, the medical lab students, and also our seniors, our residents pursuing higher learning in all these fields of internal medicine, surgery, and all the other fields. Not to also forget is the faculty members. The faculty members are our lecturers and our professors and our dean. These are the people who have been educating us and shaping us to be what we ought to be. So they're the leaders in the healthcare fields, respective fields. They're the people who are going to be guiding us to do the researches and also to guide us in expert-led thought leadership. Yes, so the other people include the practitioners who are out there. The other people are the engineers. So in this field, for example, in the digital health solutions and in artificial intelligence and machine learning, I'm sorry to say, but some of us and many of us actually in School of Medicine are not very good and very familiar with that. So it then definitely calls for a collaboration with our colleagues on the other side of the profession, who are the engineers, the biomedical engineering colleagues, and the mechanical engineers, and the software, and everyone else. So this is just a list of people who might be, but it's not conclusive. There are many other people who are not in this list, but as well might be very interested in coming in to support and also have an interest in healthcare innovation. So all of them, we are welcoming them to the platform. So some of the key focus areas you might be interested in include digital health solutions, medical devices and technology, healthcare education solutions, data management, financing model solutions. You know that today we have a challenge with the National Health Insurance Funds and the mechanisms and modalities of how to ensure that who pays what and also who benefits what. To what level can someone be able to benefit, both as an outpatient and also as an inpatient subscriber. So these are some of the things we just want to have people come, collaborate, brainstorm around, and also find the challenges and possibly build solutions to. So yes. So here, what we will be doing with this space is a number of programs. So we are saying that we want people to come up with ideas and to build solutions, and we get startups out of here. However, that will not be possible until we build the capacity first. So before you ask someone to go fish, we have to teach them how to fish. So it's very important to have capacity building events, workshops and webinars. So this, I'm very happy to have people like the Starting team, the Answer Village, Jesse and the team who are going to be our stakeholders and partners in this journey. They are the people who have been in the innovation space for some time, and they very much understand this better than us. And so that's why we are out here reaching out to them to come and help us with some of these things. The other thing is challenges. For example, we say that today or in a month or a 2 months time, we are going to have a challenge. People can keep brainstorming on, for example, coming up with the innovations around primary healthcare. So we set a day for that, and we say we are going to have primary healthcare challenges, and people come up with their pitches and their ideas. They come and share them, and then from there we can evaluate and then support the teams from there. So these are some of the things we are planning to do, and we are very excited to in a short while maybe in a few weeks or a month or so, be able to outline what exactly are the things and the workshops we're going to be doing. So these are just some products, both locally and outside, that have been in the space. And one of them is Tawi Health. Tawi Health is platform that connects healthcare practitioners to provide mental health services and other consultations to patients. And we are very proud to say that this is a product that has been founded by one of our colleagues, Victor Baraza. So Victor has been working on Tawi Health for some time now. He's been able to take Tawi Health to many platforms, and he's been building this just behind the scenes. Another one is MTBA. MTBA is also being run by one of our just graduated colleagues, and Dawa by one of our colleagues in pharmacy school. So what we realize is that people are actually working on a few things here and there, but we do not have a platform, a common platform for them to come and collaborate and to get the right support for this. So if you, for example, Victor will one day come and share his story as well, you will realize that actually there are so much challenges out here that founders and startup builders go through, but they don't get the right support. So, and sometimes people make expensive mistakes that are very much avoidable. So that's why in this space, we want to nurture the ideas and give people the right support so that they avoid making the expensive mistakes and also going through all the challenges that people go through. So on my right, I have TytoCare. TytoCare is, and this is not in any way promotive. I'm not trying to promote any product, but I'm just sharing what is some of the interesting things and innovations that are happening around the world. So TytoCare is a company that is building a remote examination devices. So for them, what they do is they have built a number of devices to be able to check the patient's vitals. For example, remotely, a doctor can be able to measure the patient's temperature, the patient's heart rate, the patient's auscultate. By the way, they can be able to even listen to your lung sounds and also your heart sounds just by using a device. I wish I was able to share that, maybe with a video or something, but maybe in the groups, and we'll have a list of resources that guys can look into. So Rology is another. They are very keen to invest and come and establish the investment here in Kenya. And Rology, what they do is they have an on-demand radiology services. For example, if I'm a radiologist, a consultant radiologist, and I'm able to provide my interpretation services, where I'm able to read the images, the CT scans, the MRIs, and interpret and put down my conclusive diagnosis, I can do that remotely. So for them, what they're trying to do is they're trying to build a network of radiologists who can be sourced on demand and also on emergency services, because we know that radiology is one of the fields that doesn't have as many consultants as possible in Kenya and also around the globe. So for them, that's what they're actually trying to do. So it's a very innovative idea. They've been trying to do this both in Egypt, in Kenya, and also in Saudi Arabia. So, and it's one of the things that is very interesting to, and very soon we should be having the founders who come and actually share their journey with us. Another very interesting one is Baby Checker. Baby Checker is a bedside ultrasound device that is used to, they use artificial intelligence to be able to detect and do an ultrasound of pregnancy in the mothers. So for them, what they do is they do 6 swabs on the abdomen of the pregnant woman, and the device that is connected to a smartphone is able to read, give you most of the important things that you need in ultrasound. So you don't need to send a mother to a clinic or a radiology center, especially when people are in remote areas. They just do 6 swabs, and it takes a very little time to train the nurses and the healthcare workers at the primary care centers. So it gives them the gestational age, the placental conditions, it gives them any abnormalities, and it's able to detect whether the baby is in the right position, whether they're in reach and all that. So these are some of the things that might be interesting to some of us who are here. So I'll just urge you to maybe check that and even more, and we'll have a list of resources that people can go look into. So how can we get involved? So being here, there's a lot of opportunities that are going to arise from this space. So we want to urge the members here to come in, collaborate, get to learn from all the things that are happening here and all the resources and all the events and the workshops that are going to be conducted. And you can participate in, the hackathons, the workshop and innovation challenges. And also, please, we want to urge you to look out for the resources that will be shared in the groups. And hopefully, we are working very much closely with the administration and Dr. Sylvia Opanga to be able to officially do a physical launch and work on the administrative things around the whole thing. So thank you very much. That's all I have to share. Thank you.
Thank you very much, Jamal, for your wonderful presentation. At this point, if you have a question, comment, and you would like the rest of us to know, please post on the chat, or if you're in a position to unmute, you can unmute and ask. Thank you.
Hi, Rich. Can I ask a question?
Yes, go ahead.
First of all, just to say, this is really amazing. So good job to Jamal and the team. I was just listening and I was like, Jamani, this should have started when I was in first year. So that I have, I get to experience it fully in the 6 years, but it's okay. So my question is, well, thinking about, myself and others like me who would really want to experience, this space. And, we're about to exit med school. We only have like 1 year left. So does it cater to like only undergrads, or like, is it open to people who finished undergrads? So interns, post-grad, yeah.
Okay, thank you for that. Maybe I can take that one, then one of the leads will take the next question. So one of the key things with launching the lab in collaboration with the administration is the scopes. So in absence is Dr. Sylvia Opanga, who, as we have mentioned, is part of the faculty trying to support some of these innovations that students come up with. And she's really keen to support innovations from both undergraduate, postgraduate, and even faculty. So for those of us who we are finalists in some of our the things we come up with, we might not be able to touch base with the rest of the lab. That is not going to be a problem. This is open to everyone. It's not even limited to medical students or dentists or pharmacists, even professionals from the other professions. As long as you have an interest to try and come up with solutions and house them within a community that is supporting healthcare innovations together with our partners, that will be okay. I hope that answers your question, Kinyanjui.
Yes, it does. Thank you. And also, just sorry, let me before someone else. My other question is, with the innovations, is it mandatory that that they're all tech-based, or like this is following the examples that Jamal has highlighted and they're in? But my question is, is the focus solely on innovations that are, IT based or like have the tech element in it?
Maybe I can pass this over to one of my leads. Nafisa, are you in a position to respond?
Yes. Wangari, thank you so much for your question. And to take that up, Afya innovation is not limited to only tech-based innovation. As you had seen, there's a number of groups which had sent out. There's one for global health. There's one that's dealing with medical device. So we're trying to find innovation in various ways, in various departments in the healthcare field. So it's not only limited to those who have IT knowledge and IT skills. I hope that answers your question.
Yes, thank you.
Okay. If we don't have questions, maybe giving this chance back to our partners, team from Startinev and Dr. Steve. Let us start with you, Dr. Steve. If you have any remarks, any information you would like to pass across, this is the chance to do so.
Yeah, thanks, Eugene, Jamal, and team. I think you've done a brilliant move by setting up a resource like this one. So I think even as you move forward, I think it's important that you realize that this is a resource that has to probably outlive you guys. So in terms of your stay probably at the university, and therefore if you have that in mind, then you open up a space and you for many people to come and gain a lot more and build and build what they like to see in the healthcare space. Now, just to add on to that is that healthcare space has been slow as other innovators. Healthcare space has been slow. We've seen transport, banking, or fintech, or financial industry and logistics moving very, very fast. So that everything is right now at the doorstep or in the hands of the users. So healthcare has been slow, and this has been occasioned by the traditional way of doing things when it comes to healthcare, but also there's healthcare needs more than just building a technology. There's trust. So if you're if the lab can look into ways that you ensure that you're going to be having products that are building trust with the end users, then that will be good, because healthcare is a bit more different compared to other services that people get, technology being a way of getting the service. So one key important thing that you will probably have to do is how to rope in the data protection folks from the government, so that you help anybody who's building a product know that they have to comply, because data protection has become quite an issue, and health data is one of those resources or data mines that people can use in ransomware. So so just ensuring that data protection is very key for all the innovators that are going to be at your lab. A second is looking at probably technology space, if you can also help with linking with NACOSTI. One of the things that I think is still lacking is something we call software as a medical device. So we don't have regulations for software as a medical device. We have regulations for medical devices. But right now, there is software as a medical device because there are many people who are using smartwatches, to check whether it's their, pulse rate, all the vitals and things like that. But who actually has calibrated all these devices to ensure actually they're giving the correct? So your lab can be a place for calibration. So you could offer this to companies like whether it's Huawei or whoever, tell them, give us a piece of your device. We want to calibrate it against some gold standard product and to see whether it's actually doing the right thing, and then you give them feedback. So that's a good place because you're in a medical school, and especially I like the fact that you are hosted at the medical school in Nairobi University. So that's that. And then lastly is being a part of the larger ecosystem for startups and technologies. So just reaching out and being a part of the collaborative efforts for incubators and accelerators that are there, so that you can link the innovators to those ecosystems. So you can reach out to any of the accelerators and incubators and have them at least know and be part of what you're doing, because they can also use your lab for many things that people are doing in the healthcare space. And like I said, again, you are at the University of Nairobi, so quite a huge and unique opportunity that you have there to be based at a university. So congratulations once again, and looking forward to working with you all. Asante.
Thank you very much for your remarks. Going to give this opportunity to the team from Statineb. Statineb, if you have any addition, any comment, feel free.
Yeah, thanks. And also Dr. you also raised quite a few good advice for the team here. Yeah, maybe a bit about Statineb for those of you who don't know who we are. Statineb stands for Startup Innovation and Events. So ideally what we do is we enable innovation within the Kenyan and East African ecosystem through running programs and events that are tailored towards startups and the tech ecosystem. So we've done that through things like running some programs like the Techstar Startup Weekend, which is an idea to MVP sort of like hackathon that happens within 3 days. So we did hold the last one 2 weeks ago. We should be having the next one at Baraza Media Labs come September, towards the end of September. We also do run Africa Hackon together with one of our board members, Dr. Bright Gameli. That's in terms of enabling the cybersecurity environment. And I think this is something also that has been mentioned in terms of the space that you play in within the healthcare space. Security, data safety becomes a very critical component of this. We've also run boot camps with organizations like GIZ, one agri-tech bootcamp called the Festival, where we brought in over 100 founders from 50 different African countries to just innovate and get access to investors within the ecosystem. And also we've worked with University of Nairobi to run the Nairobi Innovation Hackathon, which happened a few months back, and which was quite a success. And we did have a few health tech actually coming out of that. And I'm sure some of you may have been involved in that if you're within that ecosystem. So that's just a bit about us. And then later on, of course, I'll allow Wangeshu to mention about Answer Village, which is a community element where we brought in all the founders and techies within our ecosystem just to be able to collaborate. So one thing I just want to emphasize on is the need for leveraging partnerships, and that cannot be overemphasized. You actually, as the Afya Innovation Lab, you're in a very special place in terms of being able to be hosted within the university. So a lot of people are actually looking to partner with you, those that are within the health tech ecosystem. And the reason is that there's not a lot of expertise out there. You can imagine, in fact, a lot of the major players who are coming into the health tech space perhaps do not have the relevant medical and healthcare expertise in terms of having the personnel that are there. They don't have medics on board. So really, people are looking to come to you. There's also a challenge of access to data. And access to data is something, especially within this AI and machine learning era that we're living in. Data becomes like gold. So you can imagine being able to train models on various solutions that are there or for problems within the healthcare space. There's need for accessing that data. And I know a lot of that can be accessed through institutions like yours that work with various hospitals to be able to access that data. So you do have a very good leverage in terms of leveraging partnerships with other people. So that means even as you seek to grow, as you seek to be sustainable, that is a negotiating tool that you can be able to use for either people to fund your activities or for you to be able to actually continue growing that way you are, so that you can tell them you've got access to our people, you've got access to the data that we have, but then again, you also need to fund our activities. So look for that. I know people like, for example, Vidlu Africa, where myself and Kabu, Diagnosoft, are currently being incubated. I know organizations like that are always looking for partnerships, because I think right now they're signing a partnership with Mbagathi Hospital. So I can imagine also leveraging such partnerships because again, they do want to access that pool is something that would help. Think of course, all the other incubators that are there. You've got a lot of venture capital investor ecosystems that are also looking towards partnering in such initiatives. And of course, the advantage is that you also do help de-risk that. Because the reason why investors have been shying away a bit from healthcare space is because the turnaround sometimes is long, the risk is heavy. I mean, here you're talking about health. So that means if something goes wrong, perhaps people's lives are being affected. So there's really a bigger risk factor, but just being able to have the expertise there, you're able to de-risk that. So that means partnering with some of these institutions also will help de-risk them in terms of their risk appetite for coming into the health tech space. So leveraging that is important. And then again, setting up structures. That was mentioned again by Dr. earlier on, in terms of you need to build this to live beyond you, so that you can leave a legacy and know that this is something that you are able to build within your time, but also look for ways to ensure that the ecosystem continues plugging into this. So that means even people who are outside of campus, they can still be able to be part of the Afya Innovation Lab, either through giving back or through actually being incubated. So you do see a lot of university incubators that also continue to work with their students. I know like the one in Strathmore, for example, also do continue working with their students even afterwards. And perhaps a lot of the startups could also be hosted there come afterwards. So really building that structure becomes quite critical. And also only you guys can do it. So even by the time the faculty really pick up on this, I believe just being able to actually work collaboratively, first of all, you can still be able to do quite a lot. Then again, be ambitious also. Set very ambitious goals for yourselves, because really, I think being at the beginning of this is something that is really going to make a big impact. So having audacious, really big goals is something that is going to go a long way. Yeah, and health tech right now, we're not in a bad place. Last week, I don't know if any of you saw, there's a health tech company called Kasha in Rwanda that raised about $21 million US. Even those numbers myself, I can't fathom. $21 million US, not Kenya shillings, not Tanzania shillings, it's US dollars. So you can imagine there's quite a bit of funding that is going into here. We've got other startups like, apart from the ones that were mentioned here, we've got other big ones like MyDawa, Zuri Health, Tibo Health. A lot of those really have been able to scale and provide solutions to the ecosystem. So one thing that we really have to think about advantage is that right now, as you practice, as you do your internships, as you work at the hospitals, you do understand what the real needs are. some of us out here may not understand fully what the needs are, but you understand what the needs are. That means the ability for scalability is much bigger. So continue engaging not just with the ecosystem, but also with the key demographic that you seek to be serving. And you'll see the opportunities are wide. Telemedicine, health, renewable energy. You can imagine, for example, if you have mobile clinics that are powered by solar, those are huge opportunities that are there. Yeah, so it's just to encourage you. As Starting, we're here to support you. We are here to enable you. We're here to link you up to the ecosystem if you require. So feel free to reach out. I think Mohammed, we've engaged quite a bit, and I'm happy to engage with everyone else here. Yeah, so I'll leave my contacts below, but also you can reach out to Mohammed in case you need to reach out to us. Yeah, and now let me allow also Angeshi just to mention a bit about Anza Village and how, as a community, and Anza Grow can be able to support some of the initiatives that are happening within the Afya Innovation Lab. Angeshi, we cannot hear you.
Can you hear me now?
Yes, better.
All right. Sorry for that. I think one of my gadgets is struggling. Yeah. So let me just start by saying thank you. Thank you for your warm introduction to this. As I said, as a proud alumni of the University of Nairobi, for me, I cannot be more proud of this opportunity. I wish it happened during my time. And I'm seeing a lot of these innovation programs coming along. So kudos to you for doing it. As Jesse said, yes, Anza Village is a community of founders. We do currently have over 1,000 founders across Africa. In Kenya specifically, we are looking at over 500 founders. And we have other programs that goes with that, including the fact that we do have a training program called the Anza Grow Academy. And at that, we specifically tailor-make programs and training programs for anyone within the ecosystem. Let me see, let me just quickly change my device because this is a bit, just a minute.
We are still not able to hear you.
All right, apologies. I think one of my devices is crashing. So yes, so as I was saying, what we do with Anza, with the Grow program, is we train the startup ecosystem on everything the entrepreneurship journey requires you to do. And for me, that is maybe one of the proudest things that we are offering. Currently, we have a cohort 1 running and wrapping up this coming Saturday. And proud to say that I think when you went through your presentation, one of the medical or the healthcare startups that exist within that is actually within our cohort. I think Tawi Health is within our cohort, Jesse, if I'm not wrong. But just again, what do you maybe need within this whole journey? Entrepreneurship, as we say, is always a lonely journey. No matter how much of an think that it takes that you'll be fine. When you start, it looks rosy and all that, and as you continue, you realize quickly how lonely it can be. And that's why we brought in the element of the community. So it's important that you leverage that power. You can leverage that power with Anza Village, of course. We do have a Young Innovators program that we're actually launching soon. But our membership, as it stands, especially for the students, is free. So you come join us and we give you the access you need, whether it's to the incubation hubs, the programs that exist out there, and even to investors. But then in addition to that, I'm an IP lawyer, and having seen this, I can't shy away from the fact that I understand to some extent what this ecosystem, especially within the healthcare, does. I'm part of the team that bringing together the Kenya Innovation Week happening this year in in November. And one of the things that we're focusing on is research to commercialization and the role of IP. There's a huge role that IP plays in the healthcare industry. And it's important that even when you're thinking through the R&D and you're supporting the startups that comes within the Afya Innovation Hub, that you appreciate the level of innovation and how do you protect it. And there are many ways in which we're doing this. We'll be launching soon a program to support the startups together with the British High Commission in Kenya, that you can leverage some of these programs at a reduced cost than you'd ordinarily get. Have the startups that go through your program get the IP, whether it's patent, whether it's trademark, whether it's copyright, like just have them at a reasonable price. So I'm happy to have conversations on these in future. Dr. You mentioned data, and data privacy is key. And when I mention data and healthcare, I don't do so lightly. My law firm was actually the team that managed to get the first data action point last year when we took Aga Khan to task, having infringed on data on a medical client data, right? And as a result, you start realizing quickly how something like that can cripple your innovation. No matter how much you're trying to move, if you do not respect the laws and regulations, then it's going to impact what you do. And thirdly, a lot of innovations, especially within the universities, and we've been having these conversations, have been really focusing on research and development and forgetting to commercialize. So maybe one of the things that I would maybe push is, no matter the level and idea, if you cannot think through how do I commercialize and make it sustainable, then it's just, it's a brilliant gift that you give in the world, but it's not giving you anything tangible. A lot of programs are relying heavily on grants, but even with grants, we are looking at sustainability long term. So the projects that are coming through your program, try and push as much as possible towards commercialization, monetization of it, and make sure that you have a business mindset, not just innovate, do R&D without thinking how will it make money. And for me, number 4 is something that cripples the R&D space, especially within universities, is your product market fit, or inability to fit the product market fit, meaning that you have an amazing idea at the back of your head and it makes sense. And when you take it to the market, you find that the market doesn't respond. And that's because we do not do a lot of validation. So make sure that you support within the different programs that come through, that the startups and the founders understand the ability to take the product to the market at the right time. Product market fit has to make sense because you're validating and it's hitting the market at the right time. And timing is everything. That it's literally everything. And especially the hardest hit spaces, I would say, is R&D in universities, just because it almost feels comfortable to innovate around that space. You have some of these costs reduced, so people feel, I can continue doing this and testing it for as long as possible. So if something passes you, then it's past you, and it's going to be hard to come back and do it. So to reiterate, think about commercialization, think about the regulations, IP being top of the list, and data privacy, as Dr. mentioned. And of course, make sure that you think through the business mindset and bring the product to the market at the right time and let them somehow meet properly. Yeah. Otherwise, I'm happy to do this. I'm happy to offer the different support services that we can offer, both from Anza Village and Anza Grow Academy, but also from me as an IP expert in this field. I'll be happy to see what I can do. Yeah.
Thank you very much. Anybody else from the team who might want to add something?
Hello.
Yes.
My name is Dr. Mohammed. I'm not a student at the university. However, I joined this through Jamal's sharing through his WhatsApp status, and I appreciate. I'm a person who looks deeper into what is new into the market when it comes to innovations. Practiced for some time now, and there's a lot of gap. I wanted to ask a question about what about when the ideas that you have, who helps it mature? Mentor through you, mentor you through it step by step until it matures. Is there a certain kind of does Answer Academy do such a thing? Like you just know that there is this gap, and I wish it was solved through the current tech and so on. So kindly, anybody who could help answer.
Yes, I think I can take that. So thank you, Daktari, for the question. And to answer you, yes, that is exactly what we are all about and what we are trying to do. So we understand that this is not something that can only be done by ourselves. We don't, in the famous, we don't have the capacity as students. However, with the help and reaching out and in partnerships with all these stakeholders, Startinev, Vanza Village, I have Africa MedTech Hub. By the way, Dr. Sif is a founder of Gear Health, which is a marketplace for everything about digital health and the clinics, the hospitals, and there's something very big he's working on. So we should also look out for that. Africa MedTech Hub, Anza Village, Startinev, I have the University of Nairobi's C4D lab, and even the Ministry of Health. So these are the things that we are planning to do, that we can be able to not only support those innovators who already have products and they are at an advanced stage of their startup journey, but also be able to ignite the innovation and creativity, because the potential is there. However, the exposure is absent, is what is lacking. So the thing is to not only provide that space for people to come and learn about this and think about and collaborate and be able to ignite and accelerate their thinking, but also support to those who have ideas from very early stage to be able to hook them up with these resources where they can get the guidance, and also through partnerships be able to get the right support. We are very, very keen and very intentional about being in closely working with the C4D lab, which is an innovation lab in the university. However, it's a space that is for everyone in the university. So you can literally be coming from business, you can be coming from architecture, you can be coming from anywhere, and you can be incubated at C4D lab. And we are privileged to have Dr. Sylvia with us, who is part of that team. So we say we need a more focused space where people can plug into in terms of healthcare innovation. And as Jesse said, we sit at a very strategic point to be able to talk this conversation and take this to another kind of level. So yes, to answer your question, yes, that is exactly what we'll be doing, incubating the ideas, getting you the support to just help you to fine tune and to build your product for it to be able to be very viable for investment and also for scaling. Yes.
Thank you.
Yeah, okay. Kabu, do you have anything you want to add before we conclude with the latest round of questions?
Mine is just to encourage you medical students to really go against the grain. as you know, right now, artificial intelligence is taking up the world by storm, and the future is really up in arms. Really, you really can't tell which way it's going to go. So, looking at things as the way of the old is going to be it would be the biggest blunder that you could do. So, question the status quo, focus on, how can I innovate? This is a really great platform that you're starting right now. And I think that, if you continue with this sort of way of questioning things and looking to innovate, it will really help and benefit the entire Kenyan populace and Africa at large. So for me, that's all I have to say. Keep moving, and I'm really looking forward to also partnering with you and seeing this journey of this platform. Thank you so much.
Thank you so much. At this point, if there's anyone with a question, feel free to type in the chat. Yes, we have Lewis Gitao. Will the incubation hubs be able to guide and assist those of us who are planning to provide health education and awareness services? Jamal?
Yes, so as I had presented, one of the key focus areas we are looking at is health education and awareness. I believe that healthcare is not just about, that patient that walks into the clinic and, they are in heart failure, and now we are trying to treat them for all the symptoms and trying to now have them to be stable and all that. The developed world is very much ahead of us in terms of, preventive medicine, and in trying to really prevent these morbidities and mortalities from occurring way before. So why do we need to have to spend millions and billions on devices and medicines and healthcare workers and to try and treat cervical cancer, when we can go all the way to the villages and the communities to try and educate these people. And I'm very proud of one of our colleagues, Claire, here, who has been doing an amazing job in regards to cancer awareness and care for the patients. She runs a program she called Warrior Glow. So for them, I think what they do is they help the patients cope with the effects of chemotherapy, and they try to build a community of cancer patients who are there to share their journey with each other and such kind of things. So yes, health education is one of the areas we're looking into, and we want to just encourage our members and our colleagues to come up with ways to do this. So there are many, people, when people sit down to come and to collaborate and think about ways to do things, something will come up. So when we sit down and say, okay, today is health education in Kenya, people will go and research and do ways and come up with different ideas and ways they can be able to do that. Yeah, so I think those are some of the areas. And to answer your question, yes.
Thank you for that. I think, Wangeshi, this is something you can attend to. One of the participants wants to know what are the laws relating to patency, maybe briefly. Wangeshi, can anyone hear me? Maybe not audible.
Hello.
Yes, Jamal.
So I think the question is about patenting, and there's also Balua is asking about the same thing. Can you hear us?
So let me try and respond to that. Sorry, I stepped out to pick up a quick call. Yeah, so you were asking about laws relating to patenting, yeah? So what I can say is the way patents operate is almost similar to the rest of the world, in that you look for three main things. You look for novelty. Novelty means it's a new idea. And of course, you look for industrial applicability. So, and industrial applicability means if you're coming up with an idea and you're trying to create a prototype, it needs to be such that you can replicate the same concept over and over again in an industrial factory or something like that. And of course, when you're thinking about that, then you have to think through, supposing, let